Hello and welcome for a webinar on 100% success in anatomy. This is an inspirational and motivational awareness seminar for the students of first BHMS who are going to appear for the anatomy exams of the university. So I welcome you all for this special webinar. Very soon you are going to appear for the university exams. And plus, this is our last webinar. So today I declare that anatomy syllabus has been completed. Now we have to utilize this knowledge of anatomy in the examinations. So there is a special emphasis on writing the papers in university exams. And that is why we have gathered here today. Dear friends, I am teaching anatomy for last 30 years. Remember, last 30 years I am teaching this subject in my college as well as in different other colleges across the state of Maharashtra, as well as some colleges in India as well. I have performed lots of seminars in different colleges on anatomy. And I am utilizing that knowledge today in order to motivate you and to make you aware about the vasticity of anatomy and some tips to remember while answering the paper of anatomy, paper 1 and paper 2 rather. I have worked as a teacher, professor, head of the department, internal examiner, external examiner, convener, moderator, paper setter, moderator, lots of capacities I have worked into, and so I have now understood the actual problems of the students of anatomy, and that I have incorporated in today's webinar. Here we go. These are my few questions to you. Okay, like, why students fail in anatomy? Because if you see the results of first BHMS, mostly students fail in anatomy. Why anatomy is so difficult? Is it really difficult, or the subject has been made difficult by the students? So let us have answer to these questions in our follow through slides. I don't know how many of you are good in English, because this is a webinar and I'm not able to interact with you. How many of you have studied or done your schooling in English medium, for example, up to the 10th or semi-English? Because for BHMS course and also for MBBS course, you need to be thorough with your English knowledge, okay? Poor English is the main reason of failure in anatomy theory. Because what knowledge you have to put it on a paper with a legible handwriting and understandable English. And that is why the main obstacle here is English. You have to improve your English. Plus, anatomy is a very vast and tough subject. Anatomy syllabus for BHMS is most emphasized on gross anatomy as per the syllabus framed by Central Council of Homeopathy, so central government. Even though it is based on gross anatomy, still students fail in anatomy. So there is no, minutes of anatomy in your syllabus. Actually, you are supposed to study the gross anatomy, which is not much detail. Minute details are to be avoided. At least you should know the gross anatomy. And I don't know, even though your questions are posed on gross anatomy, the students fail in anatomy. In my opinion, anatomy and mathematics have one thing in common, and it is either easy or very tough. If you see, many students score more than 300 marks in anatomy out of 400. That means for them it is very easy. So I think they are having good IQ. And some students don't even get 25 marks out of 200 in theory. I'm talking about theory. So you can compare it with anatomy and mathematics. Same thing happens, in SSC exams. Really, anatomy is a difficult subject. Now you have studied anatomy, full anatomy which is meant for writing paper 1 and paper 2. Every part of anatomy I have conducted this year through webinars. Usually because of administrative work, I don't find much time to teach the students. This is the first time because of Corona lockdown, I got such a nice chance to finish total anatomy, paper 1 as well as paper 2. You know that. And I find that anatomy is not a difficult subject if you are aware about these few points. Like the terminology which is used in anatomy is either in Greek or in Latin. It is not in English also. So it's not in your original languages. You have to remember those words, okay? Because anatomy in regional languages is of no use for your course, because your course is based on English language. So medium of instruction and medium of writing papers for your course, BHMS, is English. And for MBBS also it is English. For BDS also it is English. This is not a BAMS course or BUMS course. You can use regional languages. Only English you have to use. So English plus Latin plus Greek, I think that these languages make it difficult for some students. Okay, so if you have a good IQ, anatomy subject doesn't become difficult at all. But maybe some students have a low IQ, because it happens. IQ doesn't come by your attempts to learn everything possible. By birth also you get sometimes low IQ, and in that case we have to just ignore it. You have to repeatedly do it, repeatedly study the things which you are getting difficult. That only is the solution for such students. But if the students have a good IQ and they are good in English, they can easily catch the terminology in Greek and Latin. This is my experience in this field. Actual reasons for failure in anatomy are still more. The things which is in your hand also you don't utilize, like physical attendance in the class or physical attendance for webinars is also poor. Today I see lots of students appearing for this webinar, but during last month when I finished the syllabus of anatomy, but when I started the revision, lot of students did not opted to join it. Okay, this is my own experience. Even in the class, the attendance of BHMS students is very poor as compared to other courses. Some of them are also very inattentive in the class, in the webinars also. Just try to make out your own attendance. Okay, how many of you have completed 80% of seminars, my seminar? Right now you have that answer in your own hand. You understand my point of objection. So many of you may not have attended at least 80% of the seminars of mine, which I have conducted during the lockdown. I have tried my level best to complete the whole syllabus through the webinars. Okay, that is why it is always required for everybody to remain present for the lectures, webinars, seminar, whatsoever. If you want to pass in the exams, and even for scoring high marks, you have to remain present in the class. But that is not the point, because you have already finished the course. Now you have very few hands in your hand, what you call preparatory vacation. उद्यापासूनचे 10-12 दिवसच फक्त तुमच्या हातामध्ये आहे. Okay, plus most of the students fail in anatomy theory, not in anatomy practical, oral practical. If you see the results of the whole university, students are failing in anatomy theory. That means out of 400, 200 is theory and 200 is viva practical. But out of 200, 100% is required for passing in theory here, because there is a separate passing. And students fail in theory, and many times they fail badly in theory, and they fail again and again in theory. The main reason is that your writing practice is weak. You have to do writing practice by solving question papers at home. Now also you have few days in your hand. Try to solve 1 or 2 paper at least. Now just make out how many of you have solved how many papers of anatomy. Okay, paper 1 and paper 2. You have that answer in your hand. To pass in anatomy, you have to always keep a target, whether you want to pass or whether you want to fail or whether you want to score high marks. Out of 400, if you score 320, you get a distinction in anatomy. Many students are also getting distinction these days. I have seen. भरपूर मुलं फेल जरी होत असतील तर भरपूर मुलांना 300 पेक्षा जास्त मार्क सुद्धा पडतात. If your target is of passing, just passing साठी तुम्ही जर करून गेला ना तर फेल होण्याचे चान्सेस खूप असतात. So never target at the middle ring. Always you have to target in the central ring, in the center. You know the darting, the dart has to hit the center and you get maximum score. If you hit at the center and if it is properly hit, you will score a lot. At least you will not fail, you will pass. Now these are the heads of passing in anatomy. Total 400 marks. There are 2 passing heads, theory head and viva practical head. 200 for theory, where 50% marks are required to pass. That means out of 200 you have to get 100 marks. In viva practical, out of 200 you have to get separate 50% mark. That means 100 marks. So altogether 400 marks are allotted for anatomy as far as today's syllabus is concerned. Okay. For this purpose, you should know the pattern of the question paper which is applicable to you. Now this is year 2020 and since the year 2015, there has been a change in the syllabus, in the pattern of the question paper also. So today's pattern of the question paper is applicable to you all as far as the MUHS is concerned. And I am now going to tell you about the pattern. I don't know how many of you have seen the pattern. Those who are repeaters, they have seen actual question papers. There's no point. I mean, it is not related to them. But those who are freshers, how many of you have seen the question paper pattern? And how many of you have tried to, study according to the pattern, according to the question paper pattern? Well, for that purpose, we will discuss this part paper wise. The paper 1 carries 100 marks. And it is for 3 hours. And in this paper, upper part of the body is allotted as far as the syllabus of upper extremities, head, face, neck, CNS means brain, general anatomy and general anatomy. If you see, the syllabus of paper is comparatively vast and bit difficult because of inclusion of HNF, brain, and embryology and all that. But even though the status of this paper is so, it is still easy because of inclusion of upper extremities and more marks allotted to upper extremities. So there is no problem in passing in paper 1. Paper 1 comes first. For first batch MS anatomy, paper 1 comes first. Anatomy is pariksha shuru hote. So exam begins with anatomy and it begins with paper 1. So your first day of exam is paper 1 anatomy. And there is a lot of anxiety, there is a lot of apprehension, there is a lot of fear. Okay, everything happens plus syllabus of paper 1 is difficult comparatively. That is why you should know the pattern. Nowadays, questions are asked in 3 ways, like LAQ means long answer questions, SAQ means short answer questions, and objective questions. There are no MCQs, but there are objective questions. And in objective questions on objective type of questions are always asked in question number 1, and it is always headed as write appropriate answers. That means objective answers you have to write. Total 15 questions are posed. Out of that, you have to write any 10. Each question, each sub question is allotted 2 marks. So if you write all 10 correct, each of them will get 2 marks and you will score 20 marks. Out you may get if you write the answers appropriately. And in paper 1, question 1, questions from upper extremity, 10 sub questions are asked. out of 15, 10 are for upper extremity. So your upper extremity is good. If you do upper extremity nicely, properly, thoroughly, in upper extremity itself, you will pass in question number 1. So the 10 questions are posed on upper extremity. 2 questions are for neck. 2 questions are for face. And only 1 question is for CNS, that is brain. Okay. So easy. See how easy it is. This question, actually the examiner also has to set out a question which consists specific to answers. Sometimes the examiner make mistake. They ask like a definition. So actually here they have to ask a question in 2 components. So student has to write in 2 specific answers. For example, mention any 2 muscles attached to the coracoid process. Now we know that coracoid process has 3 muscle attachment, 2 on the tip and 1 on the top. Okay. Out of these 3, even if you say 1, you will get 1 mark. And if you write 2, you will get 2 marks. And if you write 3, still you will get 2 marks, no 3 marks. Like coracobrachialis and short head of bicep, if you write they are originating from tip of the coracoid process, you will get 2 out of 2. So here what you have to do, write only appropriate answers up to the couple of correct words. Even the 2 words if you mention in the answer paper, like question number 1, A, if it is on coracoid process, I will write coracobrachialis 1 and 2 short head of bicep. I have not written any sentence. I am supposed to get out marks because my answer is pinpoint. And if you make a sentence also, then also you will get 2 marks. If you say that there are the following 2 muscles attached on the coracoid tip of the coracoid process. One is coracobrachialis, the other is short head. So here you have to write appropriate answer. How you write, how much time you get, that is different. Correct 2 words are required here. And for 1 word, 1 mark, or for 1 sentence, 1 mark. With total 2 marks per question you get here. Actually, in this question number 1, though this is an anatomy paper, no diagrams are essential. If not asked specifically, not a single examiner is asking to draw a diagram on any sub question in question number 1. या प्रश्नावरती कोणी डायग्राम काढा असं म्हणतच नाही, तर आपण डायग्राम काढायचंच नाहीये, कारण हे वर्ड्स वरती आहे क्वेश्चन. So you have to just answer it properly. And in my opinion, even though you are asked to write 10 out of 15, I suggest you to write all 15. किती वेळ लागतो अजून 5 लिहायला? एक ओळ सोडत तुम्ही करत गेला, 15 लिहा ना. 15 पैकी जे गुणवंतचे असतील, काय कसं होतं, काही एक वेळा 2 पैकी 1 मार्क सुद्धा पडतो, अर्धा सुद्धा पडतो, कारण वेळा आपल्या उत्तर बरोबर असत नाही. 15 लिहिले, त्याच्यातले 15च्या 15 बरोबर जरी आले तर ते आपल्याला 10 मिळणारच आहेत ना. So try to attempt all 15 sub questions in order to secure out marks. Here there is a chance to score out marks. So this is a very nice chance for you, both in paper 1 and paper 2. It does not take much time to write answers 5 for these extra 5 questions. Remember, not at all. Try to attempt, try to do it. घड्याळ लावून बसून बघा तुम्ही, किती सोपं आहे ते. Okay. So always remember, you write all of them and you write all 15. The examiner will take good ones and give you out marks. Okay. And there also you have to try to write it serially. आपल्याला ए येतो, लगेच आपण डी ला जायचं, मग लगेच आपण असं नाही करायचं. ए बी सी डी हे टाकूनच ठेवायचं आणि जे येईल ती उत्तर 2-2 ओळीमध्ये उत्तर लिहायचे, मध्ये 1 ओळ सोडायची किंवा जास्तीत जास्त 2 लाईन सोडायच्या. Now question number 2 is on SAQ. Write short answer. Here you have to write any 4 out of 6 and each note will get 5 marks. So you write 4 and 5 4s are 20. So out of every question is for 20 marks. Okay. Sub questions carry different. Like in question number 1, 2 marks for each sub question. In question number 2, 5 marks for each sub question. And here this question is also meant for questions from CNS, that is brain, general anatomy and embryology. comparatively this is the difficult question to most of the students which I have practically seen. But now I have taught to you general anatomy, I have taught embryology, I have taught full brain so many times. In this question, out of 6, you select the good, known 4 sub questions. Don't try to write all 6 because here you are going to waste your time. Even after finishing the whole paper, if you get time, you can do that. But here you have to select only 4 which you know the best. And when you know the best, you try to write minimum 1 full page. Full page म्हणजे पुढची समोरची बाजू पूर्ण भरली पाहिजे. पाठपुट नव्हे, एक तरी बाजू पूर्ण भरली पाहिजे. 1 full page with time management. If you get more time, you can go on the back page also to complete the answer. And here you have to draw related diagrams even if it is not asked specifically. Usually examiners don't ask you to draw a diagram. डायग्राम काढा असं म्हटलं जरी नसलं तरी आपण डायग्राम काढायचाच, कारण हा अनाटॉमीचा पेपर आहे. दिस पेपर इज अबाउट द स्ट्रक्चर्स. सो स्ट्रक्चर्स आर टू बी शोन बाय डायग्राम्स. A compulsory diagram you have to draw, minimum 1. Here you have to attempt only 4 sub questions of your choice if you are sure about your answers. And if you are not sure about your answer, you may attempt the rest of the questions, but wastage of time would affect the remaining questions. पुढचे प्रश्न राहतील म्हणून आधी पहिला 4 सोडवायचे आणि पुढचा प्रश्न घेऊन टाइम उरला तर नंतर मग क्वेश्चन नंबर 2 असं घालून तुम्ही करू शकता. इन केस इफ यू गेट अ टाइम पुरत नाही, माय suggestion to you that you go as per my today's webinar. Question number 3 is again for SAQ, write short answers. Here also same like question number 2, any 4 out of 6, and each carries 5 marks. And this question is very easy because it is all related to questions from upper extremity, superior extremity. Upper limb वरती सगळे प्रश्न पडतात. त्यामुळे here too you have to write minimum 1 full page with time management. Also draw related diagrams even if it not asked specifically. Here इथून पुढचं सेमच आहे. So same as above for question number 2 instructions. सगळं question number 2 प्रमाणेच करायचं आहे. 4 आपण निवडायचे आहेत. डायग्राम काढायचाच आहे. उरलेले जमले तर पुढे शेवटी नंतर अटेम्प्ट करता येतात. Just like question number 2. Now question number 3 is for LAQ, long answer questions. Here you have to write only 2 questions, plus you have given 50% option. There are 4 questions asked and you have to select only 2, and this is LAQ for 10 marks. So you have to write only 2 questions because it will be wastage of time. Questions from head, neck, face याच्यावरती येतात. For example, tongue, parotid gland, lateral wall of nose, and so on. And here you have to write 2 full. So for 5 marks if it is 1 page, for 10 marks it has to be 2 pages in that order. Okay, minimum 2 full pages with time management. You have to draw related diagrams if not specifically. You have to draw more diagrams for long questions, and you have to solve only 2 questions preferably. If you get time afterwards, you can attempt those questions. And the last is question number 5, 6, 7. 5 is separate, 6 is separate, 7 is separate. Out of 5, 6, 6, 7 you have to select 1 question. एक तर 5 निवडा किंवा 6वा निवडा किंवा 7वा निवडा. And question number 5 is always on upper extremity. Question number 6 is always on joint of 5 is on joint of upper extremity, 6 is on artery of upper extremity, and 7th is on nerve of upper. So upper extremity is so significant here. You have to write 1 question because it carries 20 marks, and if this 20 marks question has 4 parts, A, B, C, D. Preferably some of them ask in A, B, C, D. All 4 parts only 1 question from either of the 5, 6, 7 you have to select here, and you have to write 1 full page for A, full page for B, full page for C, full page for D. That means collectively 4 pages you have to write minimum, and making it a 4-page big answer. You have to draw minimum 4 diagrams here. I suggest you to draw more diagrams here, if not asked specifically. And plus you have to select out of, because it's a very big question, you have to select only 1. Upper limb ला तुम्हाला joint आला ना तर artery राहील, artery नाही आला तर nerve राहील. For example, shoulder joint, artery, brachial artery आणि radial nerve असा पडला. So हे सोपा कुठला? Joints. You write shoulder joint and you see that you complete 4 pages. So this is all about your paper 1. So distribution of paper 1 marks, if you see all together, it is 50 to 60 mark out of 100 for upper extremities. And for head, face, neck, all together 20 to 28. So minimum 20, maximum 28. Okay. And for brain 10 to 12. And for general anatomy 0 to, you know, sometimes no questions are asked on general anatomy. Sometimes maximum 2 are asked. So it becomes 10 marks. Embryology, maximum two short notes are asked. So it is for 10 marks. Total 100. If you see here, upper extremity has got big scope in paper 1. Now paper 2 is based on syllabus of thorax, abdomen, pelvis and lower extremity and histology. As compared to paper 1, this is easy paper, 100 marks for 3 hours. And question number 5, question number 1, how we saw in paper 1, 5 questions for abdomen and pelvis, 5 questions for lower extremity and 5 questions for thorax. 5, 5, 5, 15. Out of that 10 you have to solve just like paper 1. Question number 2 is for questions from thorax, short notes. Question number 3 is question from lower extremity and histology. Here you have got option. But still, you know, out of 6, the examiner may ask 3 on lower limb and 3 on histology, or he may ask 2 on lower limb and 4 on histology, or he may ask 4 on lower extremity and 2 on histology. 6 पैकी आपल्याला 4 निवडायचे. त्यामुळे हिस्टॉलॉजी आपल्याला मेन ऑर्गनची करावीच लागेल. He will never ask all 4 questions on lower extremity and only 2 on histology. एखादी तरी histology आपल्याला घ्यावीच लागेल. So important organ histology you study, like histology of heart, histology of bone, histology of liver, histology of spleen here. And question number 4 is for lower extremity. All short notes are on lower extremity. Question number 5, all long question on lower extremity. Question number 5, organ of the abdomen. Question number 6, organ of the abdomen. And question number 7, organ of the pelvis. So here, like see, question may come on liver, kidney and pelvis मध्ये uterus येईल. Likewise. So from here, that means big organs if you do from abdomen, this question paper goes very easy. Writing has to be same just like paper 1. Follow the same methodology as for paper 1 to solve the question paper 2 also. I have told you, same thing you apply here. If you see the mark distribution, lower extremity is allotted 40 to 45 marks. Okay. And abdomen pelvis is allotted 25 to 30 marks. Thorax is allotted 25 to 30 marks. And histology is allotted 5 to 10 marks. So altogether 100. If you see, there is big scope for lower extremities and then major organs of abdomen and thorax. Liver, spleen, kidney, then in heart, lungs. What is there in thorax? So it is very easy to pass here, very easy to score. Now this was all about your theory. Let us try to understand more about Viva and practical. For Viva practical, there are 200 marks. For practical, there are 100. And for Viva, there are 100 marks. So in practical marks, the distribution marks is for knowledge of dissected parts. Examiner will come, bring you to the table and ask you on the dissected parts for 20 marks. For viscera, means for organ, 20 marks. For brain, 20 marks. For surface anatomy or surface marking, 10 marks. And for spotting, including radiology and histology, 20 marks. And for journal and dissection cards if you have, and for communication skill altogether 10 marks. 5. So this is the what you call distribution for practical marks in examination. After the theory exam it comes. So it is of not much significance, but you should know the different heads under which the practical examination is conducted. And for Viva, out of 100, there are 4 examiners, 2 internal examiners and 2 external examiners. Each one will ask you, take your Viva on whole anatomy, whatever they want to ask, they can ask. Each one will get 25 marks. From that, he can ask any damn question on any damn part of the body. So altogether 20, when they make it collectively together, out of 100, you have to score a marks. But for scoring, you have to learn more. Those who want to score more marks, they should know more about it. Like you have to see the pattern, learn it, solve it, get it checked from your teacher, practice it regularly. And some tips also. Don't forget to write questions, sub questions in the question paper. The question paper neat liha. Question number 1, sub question A, B, C. Start writing the answer. Every question sub question separate page. Pratek page varti liha. पहिले सोडून बरं का, एक एक 2-2 मार्काचे ती आणि करशील आहे एक पेज वरती, बाकीच्या ना करा. And you have to try to answer the question paper serially, because that causes confusion to the examiner while answering. Try to go serially. You can write anyhow, but serial is always nice. No boosting, म्हणजे थापा मारू नका. Do not boost at the beginning of, सुरुवातीला तर अजिबातच मारू नका. It makes bad impression on the examiner. ह्याला काही येत नाही असं त्याचं मत होतं. Begin with exact interpretation to the required answer. Legible handwriting is a must. The examiner has to check paper. He should understand your writing, okay? And to excel more in exams, you see that you refer to the textbooks, reference books, because they are also used by MBBS students. Your syllabus is at par with MBBS. Studying hard is the only solution to pass in anatomy. Okay, self-study of BHMS students is very poor. I have seen that. You have to spend considerable time studying. Study. You must complete your reading at least thrice during the first BHMS course. I don't know how much you have done. And practice your diagram well. Do not forget to label them. Use color pencil if the instructions are so. आधी instruction वाचा, color pencil वापरायची नाही म्हटलं तर वापरू नका. And then only you can, complete the examination in a proper way. And if you keep a target of passing in anatomy, at least you will score high marks. And these points, please you remember. This is my sincere request to you, and try to follow this method. You will get 100% success in anatomy. I'm damn sure about it. If you have any questions, you can ask me. Otherwise, we will end today's webinar here. And for questionnaire, if you want to ask, you can ask immediately, because we have very less time now in hand. And with this, we end today's webinar on 100% success in anatomy. Thank you. Thanks a lot. Happy Diwali to all of you, and all the best for your forthcoming exams. And have a nice day.